Norwich State Hospital opened in 1904 on the Norwich-Preston town line. It was originally opened to house people with mental illness or diagnosed as criminally insane, but it also took in the elderly, people with chemical dependencies, and patients with tuberculosis. When the campus was built, mental health care practice called for a setting that could be considered serene, pastoral, and humane. There were places for calm walks, such as tree-lined walkways and lawns, widely spaced buildings, and a lack of walls separating the campus from the rest of the world. The buildings were set up to allow for a maximum amount of air and sunlight, and bars and signs of restraints were minimized. In the 1930s, they used metrazole shock treatment to treat conditions such as schizophrenia, where they injected metrazole into the patient to cause convulsions and temporary coma. In the 1940s, they discontinued this treatment due to the drug's high number of deaths. It was replaced by electroconvulsive therapy, sometimes coupled with insulin coma therapy. Superintendents at the time questioned the safety and effectiveness of this treatment, as it sometimes caused seizures so severe that patients could fracture their spines or dislocate shoulders and jaws. There are multiple investigations into cruelty to patients over the years. There are published reports of beating, starving, sexual abuse, overly harsh restraints, prolonged confinement, and packing patients in ice. In 1939, the Baker Commission was formed to investigate this mistreatment. When they published their report, the superintendent resigned. The patient population began to decrease in the 1970s due to advances in psychiatric medication and the deinstitutionalization movement. In 1992, the former governor suddenly announced the hospital's closure without discussing it with hospital administration. They were given very little time to find accommodations for their patients. While some were able to be transferred to other hospitals and programs, many were left homeless.